What if I told you that one of the reasons why you're not sleeping well is not stress, it's not even caffeine, it's not even because you're scrolling on your phone, it could be from a vitamin deficiency. And this is one vitamin that we've thought for so long to be mostly involved in our bone growth or bone strength, and that's vitamin D. But this is one vitamin that if you're deficient in, your sleep could be disrupted, your sleep quality could, decrease, and your sleep quantity can decrease as well. So, vitamin D helps to regulate melatonin production. Now, melatonin is that hormone that helps your body to signal sleep, right? It tells your body when it's time to sleep, when it's time to stay alert, awake. And so vitamin D helps with regulating melatonin. And so if your body has low levels of vitamin D, you would definitely feel tired. You would feel like even if you're getting good sleep, you would not feel refreshed, right? Your sleep will be disrupted. Now, vitamin D is also used in making serotonin in the body, and serotonin is one of the, precursors for melatonin. So there is a really huge connection between vitamin D and melatonin. That is really why you need to check your vitamin D levels as frequently as possible. Now, vitamin D is one of the hormones that I check if a patient comes to me and says, "Oh, I'm so sleepy, I'm so tired," and I've ruled out sleep apnea, ruled out other things like thyroid hormone issues and things like that. I definitely want to look at vitamin D levels. So during the fall, most people notice that they feel more tired, more sleepy, and sometimes the reason could be that they're not getting enough sunlight, right? So during the fall, the days are shorter, sunlight exposure is less, people tend to stay more indoors, and so there isn't enough, exposure to sunlight, and we need sunlight to make vitamin D. And so if you notice, and this is particularly worse in countries or regions where there are long winter seasons, and people could really just be so moody about the change in weather and, just want to stay indoors, don't have enough energy, don't feel motivated to do things, to exercise and things like that. So paying attention at that time to what your body is doing and asking yourself, maybe I need to have some vitamin D level check to see what's really going on, keeping up with eating or consuming food or items that are rich in vitamin D can be very helpful, or checking your vitamin D levels with your provider and making sure that you optimize those levels can help you feel energetic and less tired during those long winter seasons. So there's another hormone that behaves just like vitamin D, and that's vitamin B12. So it helps to regulate your circadian rhythm, helps you to feel awake, alert during the day, and to feel tired or sleepy at nighttime, which is exactly what you want, because you want to be productive during the day and be tired at nighttime when it's time to sleep, right? So checking vitamin D and B12 are really crucial. If a patient of yours is complaining about daytime sleepiness, or you are the patient and you're talking to your primary care, they're like, well, just get more hours of sleep, and you're getting 8 hours, but you just don't feel right, and none of those factors play a role. You've checked thyroid, sleep apnea is ruled out, all of those other things are not the problem. You can ask, can I take a look at my vitamin D? Can I take a look at my vitamin B12? Because those are levels that should definitely be optimized, okay? And don't go taking vitamin D and B12 on your own without checking the levels, because vitamin D specifically can be toxic if you go above the normal levels, right? And so knowing that and making sure you're being guided by your provider is key.